When it comes to healthcare, GE Appliances has an innovative approach that includes its on-site primary care clinic that has recently expanded. Joining us to tell us more about it is Executive Director Dr. Derek Meidlard. Great to meet you. Thanks for coming into Great Day Live.
Of course. Thank you for having me.
So tell us a little bit more about your approach to healthcare benefits with GE employees. We know so much about GE Appliances and the great work they do as a cornerstone of our economy, but you all take very good care of your employees through benefits.
We certainly try. So as you know, our employees design and make appliances. An interesting fact is that about half of U.S. homes have at least one GE appliance. How about that?
How about that?
Yes, and we want to make sure that they have benefits that are comprehensive and that meet their needs. And so, to us that means ensuring that they get the best health outcomes at an affordable price with the best care experience. And really, that really translates to make sure that they have accessible health care that is also affordable and high quality. And we work with a number of vendors to make sure that that happens.
And your services are provided to the patients at KATC, which is kind of a different approach. Explain what that is.
Sure. And
how is it different from other healthcare providers?
Yeah. So we work with KATC. They are an independent primary care integrated behavioral health provider. And so they provide advanced primary care and behavioral health counseling services at Appliance Park on site here in Louisville. They surround the patients with high value services. We're talking about full service primary care, behavioral health counseling. We're talking about limited pharmacy on site, virtual physical therapy, even a nutritionist, and even a nurse, sort of a care coach, case manager to help them navigate our pretty complex healthcare system. The care is also accessible and affordable, as I said. So appointments are either free or low cost, depending on the patient's choice of the health plan. And anyone can get in within 3 days or less, as opposed to weeks out in the community. And the appointments are longer, so that the provider and the patient can really get to know one another, and so that the provider can really address patients' health concerns or healthcare issues very comprehensively and fully. And another important aspect of this is the fact that though we partner with KATC, they are an independent company. And so all of the services are strictly confidential and private. GE Appliances doesn't get any information or receive any information, or has access to any information regarding healthcare issues of the patients.
Well, I'm curious what else is unique about your relationship with KATC, and you've said a couple of things that have already piqued my interest.
Sure.
The fact that they're on site.
Yes.
Right, that there's a pharmacy on site. I mean, these are a lot of amenities that are kind of unheard of in most workplaces.
That is true, which is why we call it advanced primary care, where you put all the high value services surrounding the patients to make sure you get those best health outcomes and cost savings, as well as great experience for the patients. But there's another unique aspect of what we do with KATC. We pay them a little bit in a more of an innovative way, where we pay them to provide value to the patients. So in other words, we pay them depending on whether or not they can deliver those best outcomes and lower healthcare costs and the best experience to the patients. We're not just paying them to see patients in the clinic. And so we measure these important outcomes, and then we hold KATC accountable financially for meeting them. So for the first time, we're really aligning payment for healthcare services with what the patient really want and need from their providers, which is better health, lower costs, and a world-class experience that's simplified.
I love, too, that what is connected to that is the whole behavioral mental health aspect of this, too, because that more and more, that is primary care health, right? That's so much how it can affect so much a part of our lives.
Sure.
We understand you also have some exciting news regarding these KATC services. What is it?
So I'm excited to tell you that KATC has expanded their services from just seeing the employees on site to now seeing employees, their family members, and dependents who are on the GE Appliances health plan. So now the entire family can get the great care that the employees have been receiving. Another interesting twist to all of this is that we have also initiated the ability for employees to be able to seek care at KATC while they're on the clock at work, We call that on-the-clock care program, where they can leave the assembly line and go see a KATC provider without having to clock out. It's a pretty innovative and unique program within the manufacturing industry.
Certainly is. Dr. Mylards, thank you for stopping by and telling us about all this great news.
Thank you so much. Appreciate
If
it.
you would like to learn more, just go to geappliancesco.com.